Now, I'd like to present our moderator for this webinar, Lydia Lauder, National Director of Programs and Public Policy at the Kidney Foundation.
Thank you, Janice. The Kidney Foundation of Canada and the Canadian Society of Nephrology would like to thank the sponsors for the support of this webinar. The Kidney Foundation would like to thank our sponsors for the 2021 webinar series, and the Canadian Society of Nephrology would like to thank their COVID-19 webinar series sponsors. COVID-19 is a serious health threat, and the situation is evolving daily. In these uncertain times, it's normal to feel anxious, especially for those with underlying health conditions. Talking to people you can trust and getting the information you need can help. The Kidney Foundation, in partnership with the Canadian Society of Nephrology, is proud to present this webinar specifically for dialysis patients. COVID-19 Vaccine Information for Dialysis Patients. This webinar will give you the opportunity to ask questions of some of Canada's leading nephrologists and dialysis specialists about the vaccine, and to hear from a dialysis patient about his experiences with being on dialysis during the pandemic. We will be partnering with the Canadian Donation and Transplant Research Program for a webinar about vaccine and transplant recipients in the coming weeks. You can keep an eye out for information about this webinar on our website, kidney.ca/webinars. The details about COVID-19 and the vaccinations are changing rapidly. The information shared in today's webinar is current as of today, February 10, 2021. The material shared in this presentation is not intended to be medical advice. You should speak to your doctor about your own individual situation. This information is intended for a Canadian audience. We are thrilled to introduce our panel of doctors and our patient partner. Thank you all for making time to share this important information today. We have a lot of content to cover, so please visit our website to read their complete bios. Vince Andrews was diagnosed with polycystic kidney disease at the age of 22. Vince has been on hemodialysis 4 hours every other day for almost 8 years, the last 3 of them at home. He lives his life as fully as possible and tries not to let the illness define or control him. When he is honest with himself, he says it's overwhelming at times, physically and especially emotionally. Vince has been on the transplant list for almost 7 years, waiting and hoping for the gift of life. Dr. Pearl is a staff nephrologist at St. Michael's Hospital in Toronto and Associate Professor of Medicine at the University of Toronto. He received his Master of Science in Epidemiology from the Harvard School for Public Health. His primary research interests and clinical practice focuses on improving the survival and quality of life for patients on home dialysis. Dr. Mueller is an infectious diseases physician and the Medical Director of Infection Prevention and Control at St. Michael's Hospital. He is an assistant professor at the University of Toronto in the Department of Medicine. His research interests are focused on epidemiology of previous hospital-acquired infections. Dr. Mueller has a particular interest in hand hygiene measurement and improvement, including the use of novel technological approaches to hand hygiene improvement. In a moment, we will post an optional poll question. You should see a pop-up box with the question on your computer screen. We will ask a follow-up question again at the end of the webinar to see if the response changes. Poll question 1. Do you or someone you provide care for plan to receive the COVID-19 vaccination when it is available? Janice, I'll ask you to share the poll results when you have a moment. So the majority of participants are looking at having the vaccination when it is available. We'll have a look at the poll at the end of the presentation, and it's my pleasure to hand you over to Vince Andrews.
Thank you, Lydia. I appreciate that. And it's great to see the large numbers of people that we have registered today for this webinar. They have asked me to, compile my thoughts on what it's been like to be a dialysis patient throughout this past year, throughout the pandemic, and compile a series of questions as well that we will put to the floor, to the doctors today. And I have tried my best to, certainly they are my own thoughts and feelings and some of the questions I've had for myself, but obviously I've tried my best to make them what I feel should accurately reflect a lot of the questions that those of you listening would have as well. So I'll just very quickly, even though Lydia touched on my story, I will give you just some perspective there. I was diagnosed at the age of 22 with polycystic kidney disease. And at that time, the projection timeline for the times I would need dialysis or a transplant was age 50. And as I like to tell people, that was a good news, bad news diagnosis in the sense that, I'm just 22. I hear age 50. So for the next 27 or 28 years, I lived life pretty fully. Let me tell you, I raised a family, I traveled, I played sports, and I worked, and I did all the things that I otherwise might have done without the diagnosis. As I say, the bad news is that they were also right, the diagnosis. And by the time I turned 50, and you wake up one morning and you're 50 suddenly, and within 6 weeks of turning 50, I began my first series of dialysis treatments. And I don't mind telling you that it was physically extremely demanding, draining, the fatigue that accompanies the treatments and so on, the tough schedule. And it was just emotionally tough for me. It was that you realize at that point in time that you are locked in to this regimen of treatments for the rest of your life, really. And the only positive way out of that is to receive a transplant. And speaking of that, I have been on the transplant list now for almost 7 years. As we say, waiting and hoping for that gift of life. And approximately 3 years ago, I began home hemodialysis treatments. And I do them 4 hours every second day at the moment. And, it's given me a certain level of comfort being at home. I feel extremely fortunate to have been at home for this past year. I've worked from home as well. So I have certainly been able to, fortunately because of my circumstances, minimize my contact and the expansion of my world during this past year. So I have, but prior to that, I had been doing very well, as I say, controlling my schedule to some degree, getting the proper rest and balance with exercise, doing well, have some stability, what I'd consider stability. And then we get a pandemic and, everybody's life is turned upside down. And I think my overriding thought during that time, especially during the initial phase when things were really ramping up, is just that absolute fear of the unknown. And I'm sure those of you listening to me today can relate to that. It is a fear for your personal safety, your family safety, what's happening in your community and just the world at large. Things are getting out of control. That's the feeling. And when things are getting out of control in any phase of your life, you tend to feel incredibly anxious about that. And I know I did. And the word for me was vulnerability. I felt extremely vulnerable. And just from a practical, functional standpoint for me, that vulnerability was in the fact that, okay, as I've said, I'm a home patient. But I kept thinking, in the early days, what if I need to go back and do in-center treatments? What if my equipment malfunctions? What about the company that supplies my dialysis equipment is unable to get, because of the backlog in air flights and so on, they can't get the supplies through, and I have to go back in-center for that. How dangerous is that for me? Is even going to get routine blood work or routine tests that I need as part of my monthly checkup to see how I'm doing or to stay active on the transplant list? Am I being compromised by visiting clinics or hospitals that way? what if, God forbid, I'm hospitalized for something more significant during the height of the pandemic? All of those things caused me, at various points, tremendous anxiety. Transplants were suspended for a period of time. And I mean, as you know, as I've said, I'm on the transplant list. So that's extremely important to me. So I was concerned about not only when that might resume, but what it would look like when it did. And of course, the most critical piece of all, was just how vulnerable am I to getting this virus? And the second and more important part of that question was, what's going to happen to me if I get the virus? And, and besides those things, the emotional vulnerability that you feel, the isolation, as we all know, from your friends, from your family. I have two children, a 23-year-old and a 29-year-old. They are a huge part of my world, and they live on their own for the past 2 or 3 years. So, and they are doing what 23 and 29-year-olds do. I mean, they are following the rules and following all of the safety protocols and so on. But their worlds are much more expanded than mine. So for me, I consider them more high risk than most people. So I have not been able to include them in my bubble, for instance. So on special occasions, on birthdays, on Christmas, I mean, one of the toughest days in a lot of years for me was this year to only be able to see my kids virtually. Just very tough. And everybody's dealing with this sort of thing, and it's just tough. One of the things I've always felt throughout this is that one of the tougher scenarios is when we are transitioning from one level of lockdown to another. I find that uncertainty around that, I almost find a greater level of comfort if we're on complete lockdown, which we have been in the past, and which sadly we may be coming up on here on the East Coast again soon, because then everybody's retreated back to their own bubble. There's little to no contact whatsoever. And the other times when things are going extremely well, then you feel much more comfortable about, socially engaging again. It's that time when we're somewhere in between and there's a period of uncertainty. That's what makes me, I believe, the most anxious. What should I allow myself to do now during this period of time? And during this past year, my partner, Amy, and I, she's both my partner and my care partner, and we have had, numerous conversations about striking the balance between continuing to live our lives and being mindful of our mental health, our emotional well-being, but staying safe. And that's been a fluid conversation. It depends on how we're doing at a particular time, or I should say how the province is doing here. And there've been some very difficult conversations. And one of the things I'm actually proud that I've recognized in myself at times is that I have not been afraid to reach out to other people, to family, to friends, and ask for help, to connect with them, because I realize it may be helpful for them as well. And then I took it a step further by recognizing that, those are good. All of the activities that we were eventually permitted to do were good. But as well, I said, I could use even more help here. And I sought through our home dialysis program the help of a professional counselor. And I have been doing that for the past really several months, and I found it very helpful. So I would encourage people that just be mindful and be aware of yourself and how you're dealing with it, just how anxious you're becoming. And, do not hesitate to reach out to your circle of support, but also for professional help. And I have, certainly been blessed with that, plenty of support, and being able to get some very practical exercises in coping mechanisms and so on. And my one goal throughout all of this period, I've always looked at the vaccine. From the beginning, from the outset of the pandemic, I've looked at that as my finish line or my start line, however you want to look at it. But I need to get there. That's what we always felt. I need to stay out of harm's way just stay safe until we get to the vaccine. And so on that, the information, when I decided that was really what I was working towards, I tried to collect as much information about the vaccine as possible. And, generally I would just advise people to be as informed as you possibly can, but be very mindful of the sources of information. Be mindful that they're credible sources of information. And if you are, for instance, tuning in today, I would consider that a very good step, something very helpful. I would talk with healthcare professionals. I would especially talk to the healthcare professionals that are most familiar with your personal medical history. Because all of us have things that are unique to us. For instance, that the vaccine may have a different effect on us depending on our unique situations. I would encourage you to find out your government's vaccine distribution plan. Do they prioritize people in our category, people who are dialysis patients, people with chronic illnesses? And where do you fit into that plan? And, from what I've seen so far, with some notable exceptions, you may not be entirely satisfied with where you fit into that plan. So I would strongly encourage you to advocate on behalf of yourself. I would encourage you to speak with these healthcare professionals, your regional healthcare professionals. I would encourage you to speak with your elected representative and your non-elected government officials. Look, there's no shame in putting pressure on in the right way, the right sort of pressure. We have to be mindful of the difficult job they are doing. We don't want to embarrass people. But if we look at the statistics that have been published by the Kidney Foundation of Canada, by the Canadian Society of Nephrology, there are alarming numbers in terms of the hospitalization rates for dialysis patients and the fatalities. So, and I can assure you on another note that the Kidney Foundation of Canada, as well as the Canadian Society of Nephrology, is advocating on your behalf, on behalf of all dialysis patients. And later, we will actually touch on that and go over some of the items that we're actually doing. So right now, I will get to, and if you folks could perhaps upload my list of questions on the screen, that would be helpful. Thank you. So yes, as I said, I've compiled these because clearly they are my personal questions, but I mean, I have many, many more than this, and I have to limit it for obvious reasons. But what I tried to do, as I said, was to capture, for the most part, what I think a lot of people might be thinking if you're a dialysis patient. And the first two are very much related, and I come at them from the context of, I feel that the vaccine is what I look towards that would give me a level of comfort, that it would give me some peace of mind. My one concern is that it might give me some false sense of security. So in that light, I would ask the question, how do the efficacy rates for dialysis patients when they are vaccinated compare with what we understand to be the efficacy rates, which I believe are in the 95% range for the general population? Like, in other words, are we somewhere in that 90 to 95% range, perhaps marginally below the range for otherwise healthy people, or are we all the way down to 50 to 60%? And by the same token, and the follow-up question in this vein is that if a dialysis patient is vaccinated, but somehow still tests positive, because that is possible, as I understand it, test positive for the virus, is it reasonable to expect a better outcome than if they had not been vaccinated? And so, I mean, I look at the odds of all of this. So, I am very much inclined. In fact, I have made the decision, unless I hear something differently prior to getting the vaccine, I have actually made the decision that I will absolutely be vaccinated at the earliest possible opportunity. And I say that because I ask myself one simple question. Is the risk of not being vaccinated greater than the risk of being vaccinated? And I felt it is. I felt clearly that it is. But what I would like to know is that, for instance, if we are down with dialysis patients are vaccinated and the efficacy rate is somewhere in the 50 to 60% range, okay, well, that concerns me. And that's why I speak to a false sense of security. If you now start to expand your world and have so many more social interactions, and then just as unsettling would be that if you were to say to me that whereas most people, most otherwise healthy people, if they contract the virus, having already been vaccinated, they should have a much better outcome. They should still have a reasonably good outcome in almost every instance. I would like to know and have some confirmation that dialysis patients could expect that too, that even having been vaccinated, if they somehow test positive, that they could still expect a reasonable outcome. My next question is, and we are aware that there are some common side effects that are associated with this. I mean, we won't be aware of the full picture of this vaccine and the effects and the long-term effects they are going to have until most of us have long since been vaccinated. But that's normal, that's natural. But what I'd like to know, of the known common side effects for other people, could those be more severe for dialysis patients, much more severe potentially? And are there potentially unique side effects that others would not experience, but that dialysis patients might? And my next question is, and I've been making assumptions to this point, and that's one thing perhaps none of us should ever do, is make assumptions about this. There's so many unknowns, but I've made the assumption that a vaccine would not affect a person's ability to be transplanted. As I say, I am personally, and I'm sure there are many on this call today who are on the transplant list. So would it affect our ability to be transplanted? Would it affect the possible outcome of that transplant? And my final question, there is so much talk lately, and I've heard numerous sources, including the World Health Organization, issue statements that say there is definite concern about the COVID variants that are making an appearance. And I would like to know, it would be very comforting to get some sort of assurance that those variants are no more of a concern to dialysis patients that have been vaccinated than they would be for any other person in the general public. So I'm going to leave it at that. Those are my questions. And like I said, I think I will be back later during the webinar to deal with the advocacy piece from a Kidney Foundation standpoint. But right now I'll turn it back over, and I want to thank you again for the opportunity to speaking to everybody.
Thanks very much, Vince, for your very poignant and important words and sharing your experiences. And I also want to thank you so much for bringing up the issue around mental health of all of us around these difficult times. And I think that that's something that I completely support and agree with you on, not to be shy about reaching out to your team for help. And also the Kidney Foundation has a number of peer-to-peer resources as well. So I don't want to talk for too long. I'm Jeff Pearl, I'm a nephrologist at St. Michael's Hospital, because I really think that the meat and potatoes of today's webinar is going to be, to the best of our ability, answering your questions regarding the COVID-19 vaccine information. And I do agree that we have many questions. Some of the questions we may not be able to answer. And if you think about COVID-19 and the pace with which research and development and what we're learning about the virus has transpired over the last 2 years, I can't think of many things in my lifetime as a nephrologist that I've seen information be gathered and developed at the same pace. So things are certainly moving very quickly, and information is changing rapidly. And I'd also like to thank my colleague, Dr. Mueller, for being on the webinar today, who's going to really be our point person for a lot of the detailed questions around the vaccine and the microbiology and virology of COVID-19. Next slide. So these are my disclosures. Next slide. And as was mentioned at the initiation of the webinar, it's an information resource only and not to be relied on or used for any diagnostic or treatment purposes. And it would be great if the questions that are submitted are generic enough that they can apply to a number of patients rather than very detailed specific questions that it might be best to consult your healthcare provider about. And so it's always important to consult your healthcare provider before making any of these decisions and for guidance around a specific medical condition, particularly with regards to COVID-19 vaccine. And as Dr. Mueller will probably enlighten us at the end, I made this presentation about a week ago, and data certainly is evolving very rapidly. And probably even today, some of this information may be lagged. And if there's anything worth updating, Dr. Mueller will certainly bring that up at the end. And so data is very much evolving rapidly. Next slide. So we're going to cover today general information regarding COVID-19. We'll talk about specific nuances that we're learning about patients receiving dialysis. We'll talk about the COVID-19 vaccine, how it was studied, how it works, and what are some of the considerations for patients receiving dialysis. Next slide. So most of you are aware, and it's hard not to be, about some of the details around COVID-19. It's an illness caused by a type of coronavirus, which is a large family of viruses. It was first recognized in December of 2019 in Wuhan, China, and it was identified as a pandemic by the World Health Organization on March 11th, 2020, and we're slowly approaching the one-year anniversary of that. Next slide. And so symptoms can really vary from person to person. They also might vary in different age groups. And common symptoms include a new or worsening cough, shortness of breath or difficulty breathing, fever, or feeling feverish without fever, chills, fatigue or weakness, muscle or body aches. A new loss of smell or taste is one of the symptoms that has been identified, a headache, stomach symptoms, or just in general not feeling yourself. And I must caution everybody that when in doubt, it's really important to get screened, of course, and get tested for COVID-19 if there's at all a concern that you may have contracted the COVID-19 virus. Next slide. So coronaviruses are most commonly spread from an infected person through respiratory droplets when you cough or sneeze, close personal contact like touching or shaking hands, or touching something with the virus on it, and then touching the particularly vulnerable areas where it can get into your body, the eyes, nose, or mouth before washing your hand. And that's why, if you can see in the picture, it's so important to be wearing a mask, particularly when you can't be socially distancing at home, because that mask is crucial to prevent the spread of droplets and transmission of droplets from person to person. Next slide. So, as I said, masking is really critical. In addition to masking, washing your hands often with soap or water and sanitizer when that's not available. And there's actually a science to washing hands properly. Avoid touching your eyes, nose, or mouth, particularly with unwashed hands. Avoid close contact with people who are sick, cough, and sneeze into your sleeve and not your hands. And I was really enlightened to hear about, unfortunately, Vince's need to separate from parts of his family, but I think a very wise decision in terms of social distancing. And obviously to stay at home if you're sick to avoid spreading the illness to others. And wearing a mask, sometimes it may be appropriate to wear a medical mask, but we're learning more and more about masking to completely cover the nose and mouth. Next slide. So this is, as of February 1st, the number of COVID-19 cases in Canada. We certainly have post-holiday period, at least in Ontario and in other parts of the country, experienced an increase in the number of cases. And Ontario in particular, the province that I live in, along with Quebec, have been particularly hotspot provinces for very high numbers of COVID-19 cases. And as of February 1st, the numbers were around 780,000. Next slide. This is the total number of COVID-19 deaths, which have in Canada been over 20,000, just over 20,000, 6,224 in my own province of Ontario. And if anybody has lost a family member or a friend or somebody to COVID-19, I just want to send out my heartfelt condolences and sympathy. And this is a really difficult time for us all. Next slide. When we talk about populations or groups of people that are particularly vulnerable to COVID-19, there's features that make a person more likely to be exposed to COVID-19. And there's also features that make a person, should they contract COVID-19, increase the risk that the illness will be severe. And so factors that increase the risk of exposure are people that work in high-risk jobs or occupations where they need to be around a lot of people all the time, and healthcare workers are a particular group. Patients that live in group settings and long-term care homes, and people that live in environments or have features that make it difficult to access or implement public health safety measures. On the other side, who are the people who are particularly at high risk for severe illness? We know that age is a very strong risk factor. People of any age with chronic medical conditions, people of any age who have a suppressed immune system, and people with obesity, which is defined by a body mass index of 40 or higher. Next slide. And so this is just data that's available publicly on the Canadian website for information on COVID-19. And if you look at people who have been hospitalized with COVID-19, which if you think about it, hospitalization is a marker for more severe illness, certainly we can see that there's progressively higher rates of hospitalization among older individuals compared to younger individuals. And thankfully, many younger individuals who contract COVID-19 will have hopefully an easier course compared to older individuals. So overall, this is around a hospitalization status that was available in a subset of patients. Next slide. And if you look at a similar graph, now not looking at hospitalization, but looking at COVID-related mortality, again, a similar picture evolves, that mortality has been particularly highest in older individuals. So age is a very strong risk factor for developing a more severe form of COVID-19 and COVID-19 related death. Next slide. This is data from that was just recently published in the Canadian Medical Association Journal. The Ontario Renal Network, I think, in my province has done an outstanding job of keeping the kidney community abreast about the impact of COVID-19 in patients with chronic kidney disease and patients receiving dialysis. And as you can see, the number of cases of COVID-19 in the dialysis population, which is on the right, the absolute numbers compared to the numbers in Ontario, very much mirror each other. So if you can see here, the risks of contracting it very much mirror what's happening in the Ontario population, which to me would suggest that there's a lot of community-based transmission of COVID-19 in Ontario, and patients on dialysis may be at risk for COVID-19 similarly as a result of community-based transmission. So this very much tracks with what's happening in Ontario. Next slide. This is unfortunately a very sobering statistic, but I think it's important for everybody to be aware. In this publication just published in the Canadian Medical Association Journal, they looked at the outcomes of patients with COVID-19. And by August of 2020, this is lagged data, 187 patients had contracted the COVID-19 infection. 62% of these 187 patients receiving dialysis were hospitalized. And the case fatality rate, the number of people who died who were receiving dialysis who contracted COVID-19 was about 30%. And when you look at some of the risk factors, Age, this is a very small study, so they may have not been able to detect a signal of age. But the thing that I want to impress upon the audience today is that although age is a risk factor in the general population, we seem to still see a disproportionate number of younger people affected by severe COVID who are receiving dialysis. So I would very much say that patients receiving dialysis should be considered a particularly high risk group for COVID-19 severity based on this information. And that's going to be important when we weigh the risks again of COVID-19 infection against the risks and benefits of getting the COVID-19 vaccine. Next slide. Is this just an Ontario phenomenon? This was a paper that was published in a large nephrology journal called Kidney International. This was a collaboration among several countries in Europe. So 7 countries in Europe got together and looked at the number of patients who contracted COVID across these European countries and the risk of having a fatal event, a death at 28 days, and a very similar trend as in Ontario. A higher proportion of patients developed death following COVID-19. And it wasn't just something in the very older population. Even younger patients receiving dialysis were still at higher risk for a COVID-19 related event. So this is again further impressing upon us that patients receiving dialysis are a high-risk population, and we need to be extremely careful about prevention of COVID-19 in patients that are receiving dialysis. Next slide. So how do we reduce COVID-19 transmission and morbidity? My clinic and other clinics have very much done as best as possible to minimize trips to the hospital and have tried to facilitate virtual care. With the help of Dr. Mueller and our infection prevention and control team, and I'm sure similar outstanding teams across the country, we've had major measures to screening prior to coming to our hemodialysis treatments, and very, very enforced and very detailed infection prevention measures during hemodialysis treatments. That will involve quarantining and isolating suspected positive patients, hand washing, universal masks for everybody receiving treatment with cleaning, infection and prevention and control measures, social distancing as best as possible in the waiting room and during treatments. And there's certainly been some increased interest and use in home-based dialysis as a means of social distancing. And that's really been a consideration for patients who are thinking about what treatment to start. And I'll talk about vaccination, of course. Next slide. So how do these vaccines work? These are the COVID-19 vaccines, the two that are currently available in Canada work via a similar mechanism. And I'm just going to go through the steps. So step 1, next slide. Blueprints. We actually don't give the virus or any pieces of the virus to people. What we're injecting is something called MRNA, which is really like a human blueprint that your body takes up. Next slide. And that's packaged in a way, and it's packaged with stuff so that this blueprint can make the journey in your body to the right cells. So you have the blueprints, you're packaging them up in a particular way. Next slide. Then the launch, the vaccination is when the blueprints packaged up get injected into your body. Next slide. And then that hopefully will get to the right place. And so it's taken up by the right cells. So you can see here the blueprint now is inside the cell. Next slide. And hopefully the blueprint, what the blueprint does is it makes antibody. And so once the cell has the right blueprints to make the antibody against the COVID-19, a particular part of the COVID-19 virus, it can start to spit out that antibody and be ready for export. And now that it has had the blueprint and it has seen the blueprint, hopefully anytime it ever encounters a COVID-19 virus, it can start to immediately churn out antibodies that can fight against COVID-19 and prevent it from entering the body and causing illness. So really what's been very exciting about this vaccine is you're actually getting a blueprint. You're not actually getting any part or anything of the virus with these two vaccines, which I'll talk about. Next slide. So again, this is just such an interesting technology, a new technology. This is an infographic our infection prevention and control group made. The mRNA vaccine is injected into the arm. It reads the blueprint and it makes an antibody. And if your body encounters the virus, antibodies are now ready and can fight off the virus before you get sick. Next slide. And so this is, again, just showing you how these antibodies are attacking the coronavirus spike protein here. The little sticks coming out of the virus are the spike protein. Next slide. So the key points is that it doesn't affect your DNA. You cannot get COVID-19 from a COVID-19 vaccine. And this is new technology, but it's not completely new technology. And this has been in evaluation for many years. Next slide. So there are two Health Canada approved vaccines with potentially more along the way. The Pfizer vaccine, which has proven to be 95% effective, and the Moderna vaccine, which has been 94% effective. And those numbers are based on receiving 2 doses. In the case of Pfizer, 21 days apart. In the case of Moderna, 28 days apart. Next slide. And so these vaccines were developed, people worry that these vaccines were developed too quickly, and I hear that a lot. But these vaccines went through the same rigor as any other drug or vaccine would need to go through to get Health Canada approval. And so they went through 4 phases of evaluation before these vaccines were licensed for use in Canada, and went through the same rigor as any other medical compound or vaccine would. Next slide. The Moderna study, the main study that was published, involved 30,000 participants. Among the 30,000, 185 people who didn't get the vaccine, who got a dummy vaccine, got COVID, and 30 of those cases were severe. 11 people in the vaccine group got COVID out of that, and 0 got a severe infection. So to Vince's initial question, this would suggest that the Moderna vaccine not only reduces the risk substantially of getting COVID-19, but also reduces the risk of COVID-19 severity should you get it. The Pfizer study was for over 43,000 participants, and similar efficacy. 162 patients got COVID in the placebo, study participants got COVID in the placebo group, 8 in the vaccine group, and 1 was a severe case of COVID. So again, reduced COVID-19 infection in vaccinated patients and reduced COVID-19 severity among people who were vaccinated and got COVID-19. And you can see very similar efficacy between the Moderna and the Pfizer vaccine. Next slide. So what are the differences between the 2 vaccines? They're both mRNA. They both were approved in December. They're both injections. They're both requiring 2 doses. The second dose is at 21 days for Pfizer, 28 days for Moderna vaccine. They're very close in efficacy, and they require about 7 to 14 days to be protected against COVID-19. And again, that might vary depending on different populations of patients. And I'll let Dr. Mueller comment on that in the question and answer period. Pfizer, we tend to give in to healthcare workers because they work in hospitals where there's a lot of access to minus 60 and minus 80 degree freezers. So the vaccines can be stored a lot easier in healthcare facilities like hospitals. Where we've had to go out into the community to administer the vaccine, that's been a little bit more of a challenge for Pfizer, and Moderna has more of an advantage in terms of remote communities because it's just a little bit easier to transport and store. Next slide. So one of the things that people asked me were any dialysis patients or patients with kidney disease enrolled in the study? And yes, there were patients with other medical conditions like lung disease or cardiac disease or obesity, but in the Moderna study. But the Moderna study, to the best of my abilities of looking through the literature, did not specifically say how many patients with kidney disease were enrolled. Next slide. The Pfizer study did, but the Pfizer study did not particularly highlight whether patients with chronic kidney disease in the study were on or not on dialysis. And among those several thousand patients, among the 37,000 patients enrolled in the study, only 256 patients had some form of kidney disease as identified in the paper. So even though there were patients with lots of other medical conditions, there were a lot of patients with diabetes, with other conditions enrolled in the study, I must say there was a very small number of patients in this study with kidney disease. Next slide. In terms of the vaccine side effects, there was no significant safety effects, severe ones that were identified after the clinical trials. Some side effects that are common include local injection site pain, fever, muscle pain, or headaches. These are most common after the second dose, sorry for the typo. And unusual side effects are very uncommon, and it's very unusual to get side effects after 8 weeks. And that is data from the studies. Next slide. If I had COVID-19, should I get the vaccine? The answer is yes. Even if you've already had COVID-19, there's not enough information right now to say how long after your infection you would be protected from getting it again. If you recently had it, however, your kidney team may ask you to wait for a period of time to get the vaccine again. They will suggest when you should be getting your first shot of the vaccine. And Dr. Mueller will talk a little bit about this, but there may be some more severe side effects from the vaccine should you get it and have had a history of having had COVID-19. Next slide. This is, again, the part of the infographic developed by our infection prevention team. Most common side effects are going to be pain at the site, redness and swelling, and some systemic side effects include fever, headache, fatigue, muscle pain, joint pain, nausea, vomiting, and diarrhea. And they look fairly similar between Pfizer and Moderna. Next slide. So who should not get the vaccines? And maybe some for now, and we're learning more about this. Less than 16 years old and less than 18 years old, the vaccines have not been thoroughly studied. If you have a severe allergy history to any of the vaccine's components, for people with suppressed immune systems, that's not necessarily the case. And again, I think it may be advised in certain cases. And this is really, I think, where it's important in your unique situation to discuss with your healthcare provider. This isn't a blanket statement to say no. And in fact, in many cases, it may be advised to get the vaccine in people who are immunosuppressed. But again, that immunosuppressed is a very broad term that can lead to that encompasses a whole range of conditions, sometimes related to medications. So it's really important to speak to your team about that. Next slide. What do we not know? And Vince, and I hate to disappoint you, but some of your questions are some of my questions. We don't know how long we will be afforded protection. We don't know if we will need boosters down the road. Is 2 enough and off we go, or will we need boosters down the road? We won't know. We don't know how it will work with the virus variants, and there's different variants, so we have to look at it on a variant to variant basis. Does it work the same in all patient groups? And again, I think a very realistic question is the efficacy of the vaccine going to be the same in patients receiving dialysis? We don't have a conclusive answer to that, but based on the data that included patients with multiple medical problems, the efficacy was the same. So it didn't look like in people with multiple medical problems, the efficacy was different, but it still is a very important question we need to answer. We don't know how effective the vaccines are in preventing person-to-person transmission. So even while the country gets vaccinated, it's really important for all of us to continue to follow all public health measures. It's not like you get the vaccine and you're good to go around without any infection prevention measures. That's not correct. We should still be following all public health measures. And we need future research for kidney patients. We need to address why some patients are reluctant to get the vaccine and understand the reasons. And we need to do more research on the efficacy of the vaccine in patients receiving dialysis and the side effects. And I'm very lucky to work with such great colleagues at local hospitals like Sunnybrook Hospital and Toronto General Hospital, where we're gathering together a research group to try to better understand how the efficacy of the vaccine works in patients receiving dialysis. So this research is in the works and very much moving forward at a very rapid pace. I just want to do a shout out to Dr. Michelle Ladunowicz at Sunnybrook, who's been a real champion in moving this forward for all of us. Next slide. So on that basis and putting it all together, the government has a really difficult task of deciding how to roll out the vaccine and in whom should get the vaccine first. And we know that there's been shortages already. So key populations have been identified based on those who are at high risk of illness severity and high risk of transmission. So healthcare workers have been prioritized, patients living in long-term care facilities, and a very other important group to prioritize are those with chronic conditions and advanced age. And I think more details will be forthcoming as each province plans its own rollout strategy to the general population. Next slide. This is an example in Ontario of the 3 phases. Again, this could be in flux. We have limited doses of the vaccines available for now. The focus has been healthcare workers and long-term care homes. Phase 2 will look at patients with chronic conditions, Indigenous populations, and other high-risk groups. And phase 3 will be a more broad implementation across the province. Next slide. This is up to date, at least from last week. We've 992,000 vaccine doses have been administered and 1.1 million doses in Canada delivered. And 2.284% of the population has received at least 1 dose. And of course, that's out to date as of today. Next slide. In looking at post-vaccine administration, Ontario has a surveillance system looking at the number of events. And I'm very pleased to say that for the moment, there's been a very, very low numbers of serious adverse events. If you look at some of the serious reports, a little bit more with Moderna than Pfizer, but I think it's because Pfizer vaccines tend to be given to healthcare workers who tend to be younger and have less comorbid conditions. The Moderna vaccine has been really rolled out more in long-term care homes. So sometimes it's very difficult to know if it's really a side effect or somebody who had many medical problems who just happened to coincidentally have a medical issue following the vaccine. But I think this is reassuring right now that surveillancing the Ontario population, and I'm sure this is being done across Canada, that adverse events, serious ones are rare. Next slide. So just to summarize and provide my concluding thoughts, COVID-19 is a significant concern, particularly among patients receiving dialysis. 2 vaccines have been approved, which appear to be safe and efficacious. We definitely need more research and knowledge to know about the long-term effects of these vaccines, and we need more specific research to patients among patients on dialysis and patients with chronic kidney disease. I would say as a general statement, most health professionals strongly recommend the COVID-19 vaccine to patients receiving dialysis, including myself. But I'm going to caveat that to say, always talk to your healthcare team about your unique situation to see if the vaccine is right for you. And it is okay to have lots of questions. And I'm hoping that you feel comfortable enough to speak to the people that help you provide care for you in the dialysis programs across the country to talk to them about the vaccine. And then lastly, as Vin said, we definitely need to make the message loud and clear that patients on dialysis should be prioritized to get the vaccine, and every effort possible that when the vaccine gets rolled out, that patients receiving dialysis are given high priority for early vaccine administration. Next slide. So this is just a slide on advocacy. A letter has been sent to the federal provincial governments by the Kidney Foundation and the CSN. We've received some response. Advocacy is ongoing, and dialysis patients at least have been listed as a priority. In BC, the rollout is in phase 3 in clinically extremely vulnerable population. And I hear from my colleagues in BC that there's ongoing advocacy to shift that to phase 2. Next slide. So these are some additional resources that you may feel free to look for more information. And I just want to thank you so kindly for your time and attention today. Thank the Kidney Foundation and the Canadian Society of Nephrology. And I'm excited to move on to the question and answer period. And hopefully we can get as many of your questions answered as possible. Next slide. I'm sorry, I'm not hearing any audio.
I'm going to try my audio again.
There you go. There you go, Lydia.
Thank you. Sorry, the joys of technology and working at home. It's one of those things in these times at the moment. Thank you for your patience. So this is just a reminder to submit your questions for the presenters by typing them into the Q&A pane found in the Zoom toolbar, rather than using the chat function. It just helps us monitor the questions as they're coming to, because they often come very quickly and fast at us. Also, thank you to those people who have pre-submitted their questions. We had quite a large volume of pre-submitted questions, so we will try and get to your questions as we can. There are a number of questions that are very similar. So if the exact wording or the exact question isn't asked, it's because I may have grouped a few together. So we'll start off with those. And also please feel free to ask any questions of not only our doctors, but of Vince Andrews. I've heard some very positive feedback on his presentation thus far, and I'm sure he'd be open to some questions too. So what I might do is scroll to the top of our questions. We will be asking the questions in English. Any questions that were submitted in French will be asked by our French colleagues as well, and will be repeated in English as well. So we might get started with some of the questions. And one was asked a bit earlier during Vince's presentation. What do you suggest for people who can't afford professional help with things such as mental health? I might start with Dr. Pearl.
So I think that at least in Ontario, we have a lot of resources in place that are of no cost to patients. We're very lucky in Canada that we have comprehensive health coverage. And so I think where the conversation should begin is if there are mental health concerns and if you are feeling challenged during this time, I certainly would reach out to your kidney care team and definitely mention that you think you might benefit from some additional support. And I'm sure social workers and nephrologists, nurses, and the whole kidney care team across the province would be very willing to help mobilize those resources. And if some of those do come as at a cost in different parts of the country, and I'm not aware that they do, but I think that I would definitely raise these issues locally and see what local solutions could be had. And I know in our program, we certainly have access to cost-free resources for patients who are expressing mental health challenges during this time.
Yeah, thank you for that. And we have a number of resources listed across the provinces that people can access as well, plus our Kidney Connect peer support program if any of the participants would like to speak to patients or other caregivers from that peer level. So I do appreciate that. So we've had a few questions similarly about the protection or what the vaccine could provide some protection or at least lessen the symptoms or danger of COVID, even if it doesn't create the necessary antibodies for dialysis patients. And I'm wondering if Dr. Mueller would like to comment on that.
Sure, very happy to comment on that. So, first of all, I'd like to remind everyone that the two things about the vaccine. The first is that it's a public good. And so it actually benefits all of us as people get vaccinated, even if we don't yet have the opportunity to be vaccinated ourselves. And as Dr. Pearl showed, the risk to dialysis patients really parallels the risk in the community. And so as more and more people get vaccinated, we can drive down the numbers, and this is going to protect everyone. But to get to the question again, we don't have trial data yet specific to dialysis patients. And so we can't say that 95% protection will apply in all immunocompromised patients, including those with renal disease and those on dialysis. But based on our experience with other vaccines and what we've seen in other immunocompromised groups, it likely will provide substantial protection, both against COVID itself, in terms of getting the infection at all, but also against severe disease. And so we're extrapolating here, and we need to collect more data for sure. But I expect that it will be protective to some degree in dialysis patients, and we'll have to wait and see whether that's 92% or 60% or where it shapes out. But what's going to protect you is being vaccinated to reduce your risk, having your care providers vaccinated to reduce the risk that they could expose you, have your family members vaccinated, have the community vaccinated. So as we have more and more vaccine, all of this is going to work together to protect you. And it all needs to be integrated with other public health measures, at least until we see the numbers across the country driven down to very, very low levels, which is going to take a long time. So we may eventually achieve herd immunity, but in between now and then, there's still going to be the need for masking, physical distancing, and other public health measures to reduce our risk.
Okay, thank you for that. Now I have a question for Dr. Pearl. Can the vaccine be injected in the same arm as my fistula?
Good question. I would say that unique policies and procedures for how the vaccine is going to be administered in patients on dialysis are being developed. I would say I don't see, if it is well out of the reach of the AV access, why that couldn't be the case. I also don't see, if there was an option to do it in an alternate arm, why one might not consider the alternate arm, just because there could be some pain and redness and soreness, and it might be better to move that as far away from the fistula as possible. So, I mean, I think there's a lot of factors there, where the location of the fistula is, if it's a lower arm fistula versus an upper arm, and all sorts of considerations. But I probably would put it in the other arm if there was an option for both.
Thank you very much. We've also had a number of questions about age-related use of the vaccine. So a number of questions have come through, particularly for people over the age of 80. And they would like to know if there's any concerns or thoughts or risks for people receiving the vaccine in this older age group.
I'll let Matt answer, but my preliminary thought is, I would say it's an even, being on dialysis plus being over the age 80 is now two very strong risk factors for COVID-19 severity. So I think that would be a group I would very much target to get the vaccine as soon as available. So those patients would have two risk factors for severe COVID-19. So I would strongly advocate that the vaccine be, considered and administered in those individuals. I don't know, Matt, if you have anything else to add about the issue.
Yeah. I agree with what you've said 100%. And just a reminder to people in general that as we're thinking of the safety of the vaccine, we also have to remember the benefit of the vaccine. So this is a slightly off topic, but even those with severe allergic reactions to the vaccine component, I wouldn't say to you, you can never get the vaccine. You just need to speak to an allergist, immunologist, and there may be ways to administer it, even in that situation where you might be at risk of a severe allergic reaction, just because of the fact that we're all at risk of severe outcomes from COVID if we get COVID, right? Even younger people without dialysis, and then your risk is only going to be that much higher if you're an 80-year-old with renal disease. The other thing I will add, though, is that in much of Canada, long-term care residents have been prioritized for vaccination. They're not only elderly, but many of them do have renal disease. Many of them have a variety of comorbidities. They're a very frail population in some of our nursing homes. And in Toronto area, at least, the vast majority of them have been vaccinated without incident. So we now have a growing experience in very elderly individuals, and people above 100 years of age, et cetera. And we've already seen benefit in terms of reducing outbreaks and transmission in those settings. So if you're an 80-year-old on dialysis living at home, you're going to be at lower risk of any kind of side effects compared to that group, but still at quite a high risk of severe outcomes from COVID. So I absolutely agree. The older you are, the quicker you want to get in line to get your vaccine when it becomes available.
Yeah, the other thing I'll add to what Matt said is that anecdotally, and I'm pushing to get this data out there, one of our local Toronto hospitals has been very successful at vaccinating a large proportion of patients. And in that initial experience, anecdotally, side effects have been very similar to the general population following the vaccine administration. I've asked them to formally document that and put that out as a research finding, so that that improves people's thoughts who may be hesitant to get the vaccine, that it is very well tolerated in our initial experience in patients receiving dialysis.
Okay, thank you very much. Really appreciate that. I'm just going to pass over the question and answers to my colleague, Hélène. Hélène, would you mind asking the question that has been submitted in French, please?
Oui, bonjour à tous. Alors, on a eu une question en français qui était « Étant bronchite asthmatique et sous dialyse, nous sommes considérés personnes avec maladie chronique. À quand le vaccin au Québec? Alors, in English, it's since we have asthmatic bronchite and on dialysis, we are considered people with chronic disease. When will the vaccine be available in Quebec?
So I could handle that question, perhaps. Unfortunately, there's a lot of uncertainty about several aspects of the whole vaccination process that have federal and provincial implications. So, the provinces are eagerly awaiting to hear how and when we're going to get more vaccine into the country, and similarly, the federal government is waiting to hear from the vaccine suppliers. So I think the true answer is we believe vaccines should be coming soon, as we've been reassured by the federal government. But individual provinces don't have complete control over that. On the other hand, what the provinces are doing or should be doing is thinking about how to distribute that vaccine as quickly as possible when it does start to flow again. And different provinces have different plans in terms of exactly how they're categorizing the highest risk groups and the order with which people will be vaccinated. And that, I appreciate that leads to huge anxieties, and I agree with Dr. Pearl that we should be advocating for the dialysis population to be near the top of the pyramid there. Having said that, if things go according to plan, which means millions and millions of doses by April, I think we'll look back and see that that vaccine starts flowing quickly. And what's more important is really going to be making sure that no one's hesitating to be vaccinated in these high-risk groups. So hopefully the question will change not to when can we get it, but more focused on encouraging people that are a bit anxious or nervous about getting it. And that'll be a happier conversation to have, because it means that we have more vaccine available.
Yeah, and just to add to Matt's point, this might come up as a question, but it's worth mentioning. Whether you're offered Moderna or Pfizer, I would take the first vaccine that you can get offered. I think they're very comparable, and at this point in time, the faster that we get a Health Canada approved vaccine into the arms of all of Canadians, as Matt already said, the safer we will be as a population. So take the first vaccine that's Health Canada approved that you were offered. I think would be my strong recommendation.
Thank you. Something very, very important to note. I'll just remind participants to use the question and answer pane rather than the chat pane so that we can capture your questions as well. We've also had a number of questions for people who are on the transplant list. They're asking, is it better to vaccinate before or after the transplant?
Yeah.
And again, I think I'll just be quick, Jeff, and turn it over to you. But I think on a quick note, if you did it would be a disaster to get COVID just right when you're about to get a transplant. Right now, there's a lot of COVID in the community. And following up on what Jeff said, I would get the vaccine at the earliest possible time that it's available to you.
Agree.
Okay, thank you very much. And are there any suggestions specifically for patients who are on immunosuppressive therapy for different reasons in considerations to the vaccine? And I know that you touched on that, Dr. Pearl, during your presentation, but it might just be good to just revisit that shortly again.
Yeah, and so, I know this webinar is targeted for patients that are receiving dialysis. Some people on dialysis still may be getting immunosuppression medications or have conditions that suppress their immune system beyond just receiving dialysis. Again, I would say it's an individual decision with the healthcare team, but in general, I would say that for the most part, we would be advocating for vaccine administration in these patients. And the Canadian Society of Transplantation has also worked on developing some policies and some statements around vaccine administration in these patients.
Thank you for referring to those. I appreciate that. And Dr. Pearl, I've got a question about dialysis patients in clinic. How do people control the space and social distancing in a fairly congested space such as a dialysis clinic or dialysis unit?
Yeah. So if ever I had to go back to the hospital and ask for more space, now would be the best time to do so. And I agree with you. Not all dialysis clinics are created equally. Some definitely have more space. Some have less space. I think spacing visits out so that not a large number of people are coming at the same time is important. We've made chairs not all available to sit on. We've put sort of blocks on certain chairs. And also getting people out in and out as quickly as possible. And, it's really key to be screened and make sure that if you're coming to clinic, you've been properly screened. And if there's any concern for COVID-19, not to be seen in clinic that day and be exposed to other groups of patients. So I think each hospital has tackled this differently. For example, Dr. Mueller and our infection prevention control team at St. Michael's have done a real excellent job at directing us on developing practices and policies around that. And so I think it's sort of a multi-pronged approach. There's many things that we can be doing to promote social distancing. The one thing I will say, and this is something that I think is important, is that if you do have chest pain or have fever or you're really unwell, I don't want fear of contracting COVID-19 to be limiting you from coming to the hospital to seek treatment if you need treatment. Unfortunately, during COVID-19, COVID-19 has not stopped heart attacks from happening, has not stopped other infections from happening, unfortunately. And so if you really are unwell, please don't be fearful to come to a healthcare setting to get the care you need, and make sure that you do get attention.
And I'll just echo that because I think it is a very important point. And healthcare facilities can and do have a lot of protocols in place to protect our patients, including trying to space them out in the waiting room, having the hospital staff all wearing masks, having the patient mask wherever that's feasible as well, and good ventilation and other measures. So the risk in healthcare settings is actually quite low. I think the community risk is higher. And although we occasionally have outbreaks that you might hear about, we consider an outbreak even a situation where 1 or 2 people have acquired COVID across the whole hospital might be called an outbreak. So I would say when you need help, you can come to the healthcare system for it, and the risk is very low.
Yeah, very important points. Thank you for reiterating that. Dr. Mueller, I might pose this question to you first. Age is a risk factor. Why are there more male deaths from COVID than female deaths?
I don't have a good answer to that. There's many health conditions where men don't seem to do as well as women. I'm not sure we have a biologic explanation for that yet. It's an observation that may be important. But I think the number one predictor of severe outcomes in COVID is definitely age. So, the older you get, not only does the risk increase, but it's actually an exponential type of increase, more so than gender, but I can't answer the question.
Thank you. And just another question that is COVID specific. Somebody's written in and they've already had COVID in about a month ago, and they wanted to find out whether they could possibly get COVID again, and would they be entitled to a vaccine when they're able to do so?
So I can answer the second part first. So right now the recommendation is to get vaccinated if you've had COVID, as we're learning more about it, and we don't know how long you're protected from getting COVID a second time. So again, when your age group or when dialysis patients are asked to come forward for vaccination, you should come forward as well and not hesitate to do that. Some people do say that it may be less urgent for you to be vaccinated if you've recently had COVID. So I'm aware of some physicians who might say in the first 90 days after you've had COVID, you could probably wait and get vaccinated after that. We don't have good evidence on that. It's just something that some people have recommended. But for now, the advice is that ultimately we would want to vaccinate you. Unfortunately, we have seen reinfections occur even with the regular strain of COVID that's been described in Canada and around the world. It does seem to be relatively uncommon though. So it's not a high risk, and particularly, like I said, in the first 90 days is not particularly common. But if, for example, you've had COVID in March or April of the year when the pandemic started, and you have a fever, it's still critically important to notify the screeners if you're coming to a health setting or coming to dialysis that you have a fever, and you would still be tested for COVID and go through all those safety protocols, because there is a chance that it could be COVID. The other concern that's emerging with some, but not all of the variants, is the possibility that infection from one variant may not completely protect you against protection from another variant. And we're still learning about that, but there are concerns with some of the variants that have emerged, particularly the ones that have emerged in South Africa and Brazil, that a second infection may be possible.
Okay, thank you. That's very valuable information. I've got a question for you, Dr. Pearl, and it's in regards to your slides about how do they do the blueprint that you presented with the medications? Oh, it was not the medications, it was actually the statistics.
Sorry, I'm not understanding the question.
Yeah, I've just got the how do they do the blueprint? So we might circle back to that question and leave that for now. Okay. There's also a question about the timing of the second dose of the vaccine. Is there a risk of it being ineffective if the second dose is given more than 28 days after the first one?
Yeah, so I'm going to let Matt answer that one, because I know this has been a very contentious issue in different provinces. Thoughts around delay of second dose versus giving the second dose on time. I don't know, Matt, if you can comment on that. In deviations from how they were studied in terms of 3 and 4 weeks apart, giving the second dose a little bit longer after.
For sure. So, to be absolutely sure that we're going to get that 95% benefit that we saw in the study, we want to follow what they did in the study as closely as possible. But I will point out right away that what was done in the study was there were a variety of different timing for the second dose. So for various reasons, not everyone got it at exactly the same time. And so a number of health regulatory agencies have looked at that data and do feel that even going out to 35 or 44 days is consistent with what was studied in those trials. So brief delays of a week or two after, being a week or two late in getting the second dose is still consistent with the data that we have about 95% efficacy. But I think even more importantly, from our understanding of immunology and vaccine science in general, in most cases, there's really no concern being too late with the second dose. It's more a concern if you get the second dose too close to the first dose. And there's actually some data from a different COVID vaccine that's not yet licensed in Canada, suggesting an even better response if you wait longer. So I'm actually quite optimistic that we could go, much further than what we are doing and still create a very powerful immune response and protection that's fairly long lasting. So I wouldn't be overly worried about a few weeks delay in getting your second dose.
I think the important point is get that second dose.
It's a really good point. And I think I have some clarification now on that blueprint question. And so we think that the question's asking how our body makes that blueprint for the antibodies that you were speaking to.
Yeah, the blueprint is actually made in a lab. People studied the way in which the virus replicates itself, and we're able to find the blueprint for the protein. So the blueprint is injected. The body actually makes the protein of the virus in itself, and that helps generate the antibodies against the spike protein. So basically, you're injecting a blueprint to produce a small protein of the virus that your body generates antibodies against.
Okay, thank you very much. I'll just hand you over to my colleague Hélène again. Thank you, Hélène.
Oui, alors la question en français est: je me demande si c'est important d'avoir le vaccin à l'hôpital en cas de mauvaise réaction. J'ai un seul rein et sujet à une réaction sévère anaphylactique. I wonder if it should be important to have the vaccine at the hospital. In case of a bad reaction, I have only a kidney and I'm prone to a severe reaction such as anaphylaxis.
Yeah, so it's a great question. Everybody who gets the vaccine is monitored, at least at my site, for a period of 15 minutes after, if there's no significant concern. As Dr. Mueller said, if you've had an anaphylactic reaction, there may be situations where you would be cleared to get the vaccine. We certainly, if there were any concern, I would talk to your healthcare provider. But in a situation where we might be concerned about a greater risk of reaction, we would monitor a lot longer and closer following the vaccine administration. So I think the answer to your question is yes, if there were high-risk features for an anaphylactic reaction risk after, you would be monitored more closely after the vaccine. I would think you would be.
Thank you very much. Do we know how long the mRNAs from the vaccine stay in the cells before being degraded?
Ooh,
that's beyond my...
Yeah.
I'll hand that over to Dr. Mueller.
Sure. So I think it's an important question, and I'll answer the question, but also provide a bit of context as well. So as Dr. Pearl said, the mRNA is what we were talking about in terms of a blueprint or code. And so when it's injected into the cells, it's a code, and then the cell's own machinery can then create the COVID spike protein, and we develop the immune response to the COVID spike protein. That mRNA goes into what we call the cytoplasm of the cell, which is a separate compartment from where your own DNA is. So they never cut, they're never close to each other, the mRNA that's inserted and the DNA that's your own cell's DNA, and there's no risk that the mRNA could become part of your DNA. So that's important to know. Within the cytoplasm where the mRNA acts, it's actually broken down quite rapidly within hours by the cell. And so it does its job to create the spike protein, and then it disappears over several hours. Certainly less than a day, and it's all gone.
Okay, thank you very much. And just in the interest of time, I'm just going to ask 2 or 3 more questions, and then we'll have to wind up the webinar because we'll have to finish up for the day. However, I've got a question now for Vince. Vince, why is it taking you, why have you been on the transplant list for so long, if you'd like to share that with us?
The very short answer, Lydia, is I'm not entirely sure. It's just, I mean, as people know, in a situation like this, it comes down to essentially the closest match for a recipient is how that works. And I guess I have not been fortunate enough at this point because nobody is necessarily prioritized on the transplant list. I don't receive notification that I've moved up 3 places or moved down or what have you. I think, and the doctors, Pearl and Mueller, can speak to this more so than I can, obviously. But, I think only if a person is in a very unique situation, a potential recipient is in a very unique, like in very ill health, or has an antibody count that's outside of the normal range, would they get any sort of unique, treatment there. But yeah, I have no idea. The typical, as I understand it, the wait time is typically about 4 years. And I have been on that list 7 years now. So I've certainly wondered why my opportunity hasn't come around sooner. But I guess it comes down to, I said, not at the risk of oversimplifying it, to be as close to the perfect match as possible. Because as I understand the way it works, if somebody is even a slightly, I keep using the word match, but if they're even a slightly better match, then that's it. They would receive that organ because they have the best chance then of being transplanted successfully. That's how I understand it.
Okay. Would our doctor panelists like to comment?
I'm sorry, I missed the question because I've been fiercely trying to typing as many answers as I can, because I know we won't get to all the Q&A.
Absolutely. Why there might be delays in somebody getting a transplant while they're waiting on the list was basically what the question was.
Oh, we need more people to step forward as living donors. We need to improve organ availability. We need to streamline and speed through the process to evaluate people. That's a webinar for another day.
Absolutely, and we can look at that for a future webinar series for sure. But looking at the time, we have just 2 minutes left, so we'll get Janice to put up the next slide, which is our final poll question for today. And Janice, can you pop the poll question up, please? There we go. So going back to the initial question that we had, do you or someone you provide care for plan to receive the COVID-19 vaccination when it is available? Okay, so we've seen an increase in the number of people who plan to receive the vaccination when it is available. Thank you very much for your time in answering that poll. And we would also like to thank our wonderful panelists today, the Canadian Society of Nephrology, for partnering with us to share this information today. The Canadian Society of Nephrology is a society of physicians and scientists specialising in the care of people with kidney disease and in research related to kidneys and kidney disease. Their vision is that all Canadians with or at risk of kidney disease will receive optimal patient-centred care and achieve the best outcomes. We've been working to develop COVID-19 guidance documents to help ensure that they continue to deliver the best possible care during these difficult times. The Kidney Foundation is committed to providing information and educational resources about the kidneys and kidney disease. We invite you to visit the Kidney Community Kitchen for recipes, information and tools to help you manage your diet. Through our regional branch offices, we offer advice and support about accessing services within the healthcare system, assisting people to self-advocate, and we invite you to connect with us if you have any further questions. So thank you very much for your time today.
Thank you, everyone, for attending this webinar, COVID-19 Vaccines for Dialysis Patients. On behalf of the Kidney Foundation of Canada and the Canadian Society of Nephrology, thank you for joining us today. Stay well and enjoy the rest of your day.